Hey everyone, we are going to discuss everyone's very favorite subject, and that is pharmacology. We are going to keep it simple, we're going to keep it light, we're going to go over it so you can listen over and over again until you're familiar with these medications and you're able to pull them up quickly in your knowledge base when you need them when you're working in your career. So the first thing that we want to make sure that you understand is what medications we can pull and from the medicine cabinet and place directly down the endotracheal tube. So we would place them down the ET tube, then flush them with a bolus of normal saline, at least 10 milliliters, okay? So the medications that we can place directly down the ET tube are Narcan, atropine, Valium and Versed, epinephrine, lidocaine, and surfactant. So we can use the mnemonic NAVELS, NAVELS. So that's Narcan, which reverses overdose of medication. Atropine, which can stimulate the heart. Valium and Versed, which can put the patient at ease and sedate them. Epinephrine, which can stimulate the heart again. It's our first drug that we use during a code, so we can put it directly down the ET tube. We can put lidocaine down the ET tube as a numbing agent or to help with PVCs. We can also put surfactant down the ET tube to help decrease surface tension in the lungs of our premature babies that have not had time to produce their own natural surfactant. So remember that we put that down, then flush with 10 milliliters of normal saline. You may want to use the resuscitator bag, especially when you're putting down surfactant. You would want to use a resuscitator bag and turn the infant from side to side and as you're administering. So NAVELS, NAVELS, Narcan, atropine, Valium, Versed, epinephrine, lidocaine, and surfactant. Okay. Next, we're going to move on and talk about the mnemonic OMAN, OMAN, and that is the algorithm that we use for chest pain. So we can give the medications oxygen to help combat hypoxemia, morphine for pain, and it also can stimulate the heart, aspirin as a blood thinner, and nitroglycerin. We can place that under the tongue or other ways in order to help with the angina. So for chest pain or angina, we use the mnemonic OMAN, which is oxygen, morphine, aspirin, and nitroglycerin. The next thing we're going to discuss about pharmacology that we definitely need to know is that we cannot give Atrovent and atropine together. You don't give two medications together that are from the same drug class. Okay? So two parasympatholytic drugs like atropine and Atrovent cannot be given together. Okay, so Atrovent and atropine are cholinergic or parasympatholytic drugs. We also give racemic epinephrine. When do we give that medication? When we have a child who comes maybe to the emergency room or is admitted to the hospital with croup, which is also known as laryngotracheobronchitis. They will have symptoms of stridor. It may also occur post-extubation due to airway edema because of the removal of the ET tube as it slides through the vocal cords. It can cause inflammation, and that will result in some stridor. We know that if it does result in stridor and it's described on the test as moderate stridor, then we would just give the racemic epinephrine. But if we see a description of the stridor as marked stridor, then we would need to re-intubate the patient. So watch those key words when stridor is being described, and if it's in post-extubation situation, make sure that you act quickly and re-intubate if it's described as marked, because that is emergent and critical. So we need to protect that airway. But if it's just mild or moderate, then we can just give the racemic epinephrine. Some other things we want to talk about when it comes to pharmacology is that we have bronchodilators that we can give the patient to help combat bronchospasm or treat the already occurring bronchospasm, and that is the number one bronchodilator is albuterol. We have other medications that are longer acting but take longer to take effect, like Atrovent. And we have medications we've not really used in a while but maybe on the test, like metoprolol, which is another name of Alupent, which has a higher effect on the heart. It causes tachycardia more so, and it may be more uncomfortable for the patient. If you do give the patient a bronchodilator like albuterol and they complain of tremors and discomfort, then you can use the medication Xopenex in order to not have as many side effects like an increased heart rate or tremors, and they feel more anxious, but it's a normal side effect of a bronchodilator to have those symptoms. But if they find them unbearable or their heart rate goes too high with albuterol use, then you can recommend and initiate that change. So some other medications we need to make sure we are aware of are the mucolytics, medications like acetylcysteine, also known as Mucomyst. It comes in 10 and 20%. Usually we use 1 to 4 milliliters per breathing treatment. We want to always give Mucomyst or acetylcysteine with a bronchodilator. It can cause bronchospasm and worsen bronchospasm, so we don't give it to an asthmatic. It is contraindicated for use with an asthmatic. So, but regardless if they have asthma or not, anytime you administer nebulized acetylcysteine or Mucomyst, then you need to include a bronchodilator. So some other things that acetylcysteine is used for is to reverse Tylenol overdose. You may see it used in the emergency room, and the patient's actually required to drink it, or it's put down the OG or the NG tube to help reduce the side effects of Tylenol overdose. Okay. We know that oxygen is considered a drug. Don't forget that. If you're asked, it is regulated by the FDA. That it has to have a prescription anytime that oxygen is in use. We have the patient wear either a nasal cannula, simple mask, air entrainment mask, a partial rebreather or non-rebreather, or a device like a CPAP, BiPAP, or NPPV, in which we inline the oxygen into, or mechanical ventilation, to which usually the machine has a oxygen blender built in, and a high flow nasal cannula. We can use oxygen via blender with that. And there's several different ways to administer oxygen, but the thing you've got to remember is you've always got to have an order regardless, and that order needs to have the type of device that the oxygen is going to be delivered by, the liter flow or the FiO2 or both, and how much the patient should wear it. So if they are receiving home oxygen prescription, then they need to have the liter flow and how many hours per day. whether it be at night, nocturnally, or 24 hours a day, or just with activity, then that needs to be specified on the order. We can also add humidity, which is very important with oxygen use, especially at the higher liter flows, because it can cause dryness of the airway. Some other things that we need to talk about when it comes to pharmacology is the use of furosemide, also known as Lasix, and that is given to reduce pulmonary edema. You will see that on the test several times, regardless of which test you're taking. We talk often about furosemide and pulmonary edema because that stimulates the kidneys to increase urination and to decrease that fluid overload. So it's a very important medication in our field. Some other medications that we will see on exams and during our careers, tensilon test or edrophonium is used to test for myasthenia gravis. Also the Guillain-Barré is another neuromuscular disease we see a lot, and it's not diagnosed by a medication, but instead it is diagnosed by pulling CSF fluid from the spinal cord and doing diagnostic testing with it. So make sure you differentiate between which neuromuscular disease requires medication to diagnose, which is myasthenia gravis, not Guillain-Barré. A lot of people get that mixed up, and that can cause you to miss a question. Also used with myasthenia gravis is prostigmine, which is helps to treat the disease. Okay. Some more medications that we may see on the test is digoxin or digitalis, which increases the contractility of the heart. It helps during fluid overload because it just increases the pump action. So make sure you're familiar with that medication. We use helium, which also has to be prescribed. We mix that with oxygen to via non-rebreather mask if the patient's having problems with refractory hypoxemia. We also can use the OptiFlow or AirVO2, which is in a high-flow nasal cannula.